Greetings, and welcome to the Spring 2022 Civic Engagement Public Speaking Contest, hosted by the Department of Communication Arts and Sciences at Penn State University. My name is Michael Studeman, and I am the director of CAS 100, the introductory public speaking class that is taken by thousands of students each year here at Penn State. In order to recognize the strongest students in their classes, instructors select a top student from each section and give them an opportunity to participate in this contest. Once selected, students participate in a preliminary, a semifinal, and then finally the six-person final round that you're about to watch to determine some of the strongest policy speeches in our department. Before we begin this contest, I want to take a moment to thank a few people that helped to make it a reality. First of all, I want to thank Kelly Sweeney. As the Assistant Director of CAS 100, Kelly has done an outstanding job of making sure that this contest runs smoothly. She coordinates judges, she assigns students, she makes sure that all of the tabulations are done correctly, and she generally just does all of the work behind the scenes, other than emceeing the contest like I'm doing now. Secondly, I want us to recognize the administrative staff, including James Updike and Emily Bush-Clark, who play such a pivotal role in making sure that the rooms are assigned, that the YouTube video works well, and all the other nuts and bolts types things that make sure that this contest runs well. And then finally, I want to thank the instructors of CAS 100, who have done work to nominate their students, urge them to participate, coach them, and then finally to judge the contest itself and make sure that students receive a fair hearing for all of the great work that they've done. Additionally, I'd like to take a moment to thank the three judges that we have selected for this final round. Our first judge is a recent recipient of an Outstanding Alumni Award from the Department of Communication Arts and Sciences. Leah Triola was a graduate with a Bachelor's of Arts degree from CAS in 2009. After that, she received a JD from Widener University Delaware Law School and worked for a few years as a plaintiff's personal injury attorney. Since then, and more recently, she has been working as the Senior Director of Football Operations and Administration at the National Football League. In that role, she has worked with collective bargaining agreements, league policies to ensure equity and integrity, and finally, internal operations of the NFL. And so she brings a great deal of expertise to this work of judging. Secondly, I want to thank Marcy Milholm. She currently serves as the supervisor of CAS 100 for engineering students, and she does tremendous work in helping students translate the complex technical expertise that they have as engineers into terms that everyday people can understand. Additionally, Marcy plays an important role in developing curriculum for CAS 100, including a lot of the curriculum related to the policy speech, which is the basis of this contest. So she definitely knows what she's looking for. And then finally, in recognition of their achievement in this contest, we often invite contest winners from previous years back to judge for us in later semesters. To that end, our final judge is Isabel Hatch. Isabel is an undergraduate in the Smeal College of Business, and she plans on majoring in finance. In the fall public speaking contest, she earned first place with a speech that was titled Campus Safety at Penn State. And if you want to watch that speech, you can actually find it here on this YouTube channel, along with the other excellent speeches from the fall contest. And so, with all of that context, I would like us to go ahead and get ready for the contest itself. So, take a moment to sit back and relax. You will soon see all of the speakers introduced by their instructors, and you will learn a little bit about each one before they go. And so, thank you for joining us, and have a wonderful evening.
Greetings to the esteemed judges of the Penn State Civic Engagement Speaking Contest for Spring 2022. I've been tasked with giving a little bit of an introduction to my student in the finals, Frederick Miller, or as we affectionately call him in class, Freddie. All right, my name is Mark KOHLER. I am an assistant teaching professor here in Communication Arts and Sciences, and Freddie was my student this year in Section 30 of CAS 100A. He is a Bachelor of Arts Theater Studies major. He's actually double majoring in Bachelor of Arts in Theater Studies with an emphasis on dramaturgy, as well as a Bachelor of Arts in Comparative Literature, with also an emphasis in drama. His big passion is to increase access to the arts and also to help shepherd a new generation of artists. He's very passionate about that, and he expects to graduate later this year. And a little bit about Freddie in our class. He has been a wonderful student all semester long, and everyone pretty much loves Freddie. And it's kind of funny is that when we went to do our are polling for the speech contest, and I mentioned Freddie as one of the candidates that I thought should enter in. No one else in the class wanted to go up against him. And this is a very strong class as well, but as soon as I said it, many people in the class just said, when you said someone to do the contest, we all thought of Freddie, and they're all very proud of him. And I'm sorry that my video is probably not going to be as staged, lit, or as engaging as his, but I think you can tell that Freddie is very passionate about this topic, and I only wish you could have seen his motivational speech on this topic. It was equally as powerful, and I thank you for your consideration, and I hope you enjoy Freddie's speech.
How many of you know a member of the LGBTQ+ community? The chances you do are probably high. According to a 2021 ABC News poll, more than 15.9% of Generation Z adults identify as lesbian, gay, bisexual, or transgender. And who are these people? They're your classmates, your neighbors, your siblings, maybe you yourself. Now imagine that that person you're thinking of is being forced to undergo therapy to attempt to change a fundamental aspect of who they are because someone else thinks that it's wrong. This is a very real scenario for LGBT Americans. The Human Rights Campaign, the US's largest advocacy group for LGBTQ+ people, defines conversion therapy as a, quote, practice that falsely claims to change a person's sexual orientation or gender identity or expression. While several states have independently passed laws banning this practice at the state level, there is no federal ban. The Therapeutic Fraud Prevention Act of 2021 is America's strongest chance at protecting LGBT Americans from conversion therapy. Today I will describe in detail the horrific ramifications of conversion therapy, what the Therapeutic Fraud Prevention Act of 2021 proposes, and why it is necessary. Conversion therapy assumes that a person who has same-sex attractions and behaviors is mentally disordered. This belief contradicts the positions held by the American Psychiatric Association, or the APA, as well as other mental health and biomedical professional organizations. In 1997, the APA produced a fact sheet on homosexual and bisexual issues, stating that, quote, there is no published scientific evidence supporting the efficiency of reparative therapy as a treatment to change one's sexual orientation, end quote. In almost all cases, the motivation for conversion therapy is driven by religion, not science. In the US, religious groups, specifically Christianity, promote the concept that an individual can change their sexual orientation or gender identity either through prayer or other religious efforts. In a qualitative study exploring the experiences of LGBT Americans in the American South, specifically in a region known as the Bible Belt, researcher Joseph J. Frey found that the South includes the largest population of LGBT adults in the US at 35%, and yet these are the states in which the least number of protections exist for LGBT Americans. The long-term effects of conversion therapy are endless. In a feature for Counseling Today, Dr. Joy Whitman, a licensed professional counselor with expertise on LGBT issues, noted that, quote, conversion therapy thwarts self-acceptance, causing depression, anxiety, shame, self-hatred, social withdrawal, thoughts of suicide, homelessness, and drug use. A San Francisco study corroborated Dr. Joy Whitman's sentiments, finding that, quote, highly rejected LGBT youth face a higher risk of negative side effects than their non-rejected counterparts. Leila Alcorn is a horrific example of what could happen. Leila was an American 17-year-old transgender girl who committed suicide by walking into the pathway of an oncoming tractor trailer on Interstate 71 at 2:15 a.m. on the morning of December 28, 2014, 3 days after Christmas. In her suicide note posted on the social media site Tumblr, Leila explained her struggle for acceptance from her parents. My mom started taking me to a therapist, wrote Leila, but would only take me to Christian therapists who were all very biased, so I never actually got the therapy I needed to help cure me of my depression. I only got more Christians telling me that I was selfish and wrong and that I should look to God for help. Leila Alcorn is just one story. There are many others. Now that I've shown you the severity of the problems posed by conversion therapy, let us examine what can be done to prevent future tragedies like Layla Alcorn. The Therapeutic Fraud Prevention Act of 2021 has been introduced in the Senate by Senator Patty Murray with overwhelming support from Senate Democrats. In this bill, Congress sides with science in acknowledging that being LGBT is not a choice and cannot be changed with therapeutic practices. The full bill, available for public viewing on congress.gov, would officially classify the provision and advertising of conversion therapy in exchange for monetary compensation as a fraudulent practice. This bill would expressly direct the Federal Trade Commission to protect consumers from these harmful and discredited practices. It would also grant authority to the Attorney General of the United States to bring civil action on behalf of the victims. The current iteration of the bill was introduced in Congress in June 2021 and would need to be passed in both the House and the Senate before being sent to President Joe Biden's desk for signature. Now that I've introduced you to the Therapeutic Fraud Prevention Act, let's discuss what makes it the best option. This bill ensures protection for LGBT Americans at the highest level. This defect that exists in present policies is that there currently are no present policies at the federal level. Proponents of conversion therapy argue that any laws made to ban conversion therapy are a direct violation of freedom of speech protected by the First Amendment. Proponents of conversion therapy argue, specifically in the state of Florida in 2020, two practicing therapists filed a lawsuit against the state for laws banning conversion therapy. According to a November 2020 article from The Advocate, therapists Robert Otto and Julie Hamilton felt that these laws infringed upon their First Amendment rights. The federal appeals court, with judges appointed by former President Donald J. Trump, sided with Otto and Hamilton. This case in Florida is a clear example as to why, if left to individual states to decide, legislature banning conversion therapy will not happen. In fact, preliminary injunctions currently exist in Alabama, Georgia, and Florida preventing enforcement of conversion therapy bans. According to a 2018 Williams Institute report, it is estimated that approximately 20,000 LGBT minors in states without protections will be subjected to conversion therapy by a licensed healthcare professional before the age of 18. It is possible to enact these bans, and we've seen it done successfully and with bipartisan support. In a 2013 signing of his state's legislative ban, Republican New Jersey Governor Chris Christie expressed that, quote, exposing children to these health risks without clear evidence of the benefits that outweigh these serious risks is not appropriate. The time is now to enact the Therapeutic Fraud Prevention Act. Today I've discussed the problems posed by conversion therapy, how a federal ban can help negate these problems, and why it is necessary for it to happen. Despite being debunked by every major medical organization in our country and abroad, there remains a mindset that conversion therapy can actually achieve in turning LGBT Americans straight. This dangerous therapy can and has been shown to have had negative lasting effects on its patients. The Therapeutic Fraud Prevention Act of 2021 can ensure that no one will ever be forced to undergo these practices again and punish those who seek to facilitate them. Following Layla Alcorn's suicide in 2014, President Barack Obama delivered the following address. Tonight, somewhere in America, a young man will struggle to fall asleep, wrestling alone with the secret he's held onto as long as he can remember. Soon, perhaps, he will decide that it's time to let that secret out. What happens next depends on him, his family, as well as his friends and his teachers and his community. But it also depends on us, the kind of society we engender and the kind of future we build.
Hi, my name is Vanessa McLaughlin, and it is my sincere pleasure to introduce to you Emily Bremersky. Emily is a sophomore student from Lancaster, Pennsylvania, studying biobehavioral health and psychology. In high school, Emily noticed several of her fellow students struggling with and even losing the battle to mental health. Emily proposes a remedy to help fellow college students who are facing similar struggles. Please welcome Emily Bremersky.
Let's all close our eyes for a moment. I want you to think about a time when you felt prolonged feelings of stress, anxiousness, or maybe even depression. Did you ever get professional help? If not, what was stopping you? Maybe you felt overwhelmed, or you didn't want to go through the excruciatingly long process of getting into CAS. Or maybe you felt alone. I can safely say if you have experienced any of those feelings, you are not alone. A study done by Mayo Clinic in the fall of 2021 found that 44% of college students reported feelings of depression and anxiety. As a college student with a rigorous school schedule and many extracurricular activities, I have experienced my fair share of mental health struggles, especially during the pandemic. I've also seen firsthand how UHS and CAPS services are overworked and ill-equipped to meet the needs of students at Penn State. Although CAPS is a place for Penn State students to use when in need of mental health support, nevertheless, the pandemic and increasing rates of mental health issues among college students are overwhelming the system, which is why Penn State should create mental health advisors. I'm going to explain the mental health problem at hand, how it is harming college students, what the inefficient existing plan is, and how my specific policy will result in improved mental health and accessible help for Penn State students. To illustrate, mental health struggles have been increasingly plaguing college students due to the pandemic, leading to a decreased social life. This caused fewer extracurricular activities to run, and has given students so much uncertainty about their fast approaching futures. In March of 2021, the Washington Post reported that the rate of depression among college students was up to 90% higher during the early months of the coronavirus pandemic compared to pre-pandemic levels. 90% is a huge increase, and that needs to be addressed. Furthermore, I've also heard time and time again how difficult it is to make appointments with CAPS. Even while researching for this speech, I had a hard time navigating their website and determining how to even begin scheduling an appointment. From what I've gathered, I understand that there's a phone line where you wait on hold for who knows how long to speak with someone. Then, if you get a hold of someone, you can schedule a pre-screening. Then after you do that pre-screening, if you're lucky enough that they have availability, you can schedule your first appointment. Then, students often feel uncomfortable going to that first appointment, meeting with someone that they've never met with before to discuss such strong, personal, and vulnerable emotions. This overwhelming process deters students from getting the help that they need, potentially leading to serious consequences. According to Mental Health America, 50 million Americans suffer from some sort of mental illness. Many people with mental illness struggle to acquire, locate, and afford care. That process becomes even more difficult for a college student with a busy schedule. But college students may need that help the most. A study published by the Journal of Affective Disorders in 2021 found that suicide is the second leading cause of death among college students. It is obvious that many college students are in dire need of help. Accordingly, I believe that Penn State should create a position to have a mental health professional assigned to each student. This position would be similar to an academic advisor, but they would be solely in charge of mental health concerns. I imagine that students would schedule an appointment on Starfish like they do with an academic advisor. There would be appointments of 45 minutes available on Zoom and in person so that students can meet in whichever format they feel the most comfortable with. One mental health advisor would be assigned to about the same number of students as an academic advisor is, as it's anticipated that students would only meet with this person around 2 to 4 times a year. The mental health advisor is for quick problems and initial help, as they will then guide students through the process of either getting into CAPS or finding long-term solutions. This new plan will be implemented as a system change, capacity builder, and inducement. It's a system change in the way that the school administration works will change, as academic and career counseling will be completely separate from emotional counseling. The capacity builder technique will also be used so that students and staff are educated about the mental health resources that are available to them and how they shouldn't be apprehensive to explore those. They will also learn the purpose of having this mental health professional accessible. Inducement will also be utilized, so students are required to meet with this mental health professional at least once each semester to get extra credit in their wellness classes. This will ensure that this new solution is worth the change and is taken advantage of. To make this policy a reality by 2025, I plan on speaking with Penn State administrators ranging from the heads of Penn State to CAPS and even the psychology graduate school department. In particular, my proposed plan will undoubtedly decrease the mental health struggles facing Penn State's student population. The American Psychological Association found that 75% of people in psychotherapy benefit from it. This proves that speaking with a professional does make a difference. Encouraging students to meet with their mental health advisor will aid in destigmatizing getting help for mental illness. If Penn State were to implement this plan, it would affect over 40,000 undergraduate students at the University Park campus alone. No doubt, the university administrators will argue that creating this new position will be expensive, as a new position means more staff and more salaries to be paid. Along with this, it will be mentioned that mental health professionals are in high demand but short supply, especially in a rural area like State College. To solve both of these problems, I am recommending that Penn State allow their psychology graduate school students to get class credit for working in this position. This would save money, relieve the time and stress of finding trained professionals, and would give graduate school students a unique opportunity and experience that other programs aren't offering. In spite of the counter-arguments, the advantage to my proposal is that students will be provided with one individual to connect with about mental health. This will be a unique system because students will be able to learn from, grow with, and get to know this person over their whole entire college career. This will make the first steps in getting help easier, faster, and more comfortable. In turn, this will reduce anxiety and depression rates among students and will take stress off of CAPS. For this reason, even with CAPS in place, the mental health crisis facing college students is far too large for them to handle, which is why Penn State should hire mental health advisors to be the first contact for students in need of mental health services. When surveyed by the JED Foundation in August of 2020 about school resources to assist with mental health, 71% of college students said that telemental health would be appealing to them. This report indicates that college students want more options for mental health resources from their university. College students want to be happy and healthy in all aspects so that they can succeed and reach their goals, but they need your help to get there. Penn State students chose Penn State over thousands of other universities for the sense of school pride, unique experiences, and for the care and love shown towards the students. Let's show our loyal and prideful students that we are really there for them by giving them the mental health resources they deserve. Thank you.
Hello, my name is Johan BODASKI, and I am an assistant teaching professor in the Department of Communication, Arts, and Sciences. This semester, I had the privilege of instructing our next speaker, Zachary Stanton, in CAS 100A. Zachary is a junior marketing major in the Smeal College of Business. And in this speech titled Sexual Assault on Penn State's Campus, Zachary goes in depth about the root causes of sexual assault on University Park campus and offers a policy response that responds to those root causes. Please welcome our next speaker, Zachary Stanton.
My freshman year of college, I got a call from a very close friend of mine at about 3 a.m. telling me that she was walking home alone from frat row by herself. Sensing that something wasn't quite right, I jogged to downtown State College, and as I approached her, I saw a guy walking behind her, and the closer and closer I got to her, the faster and faster he started to walk in the other direction. That was the first time that I saw the true weight of what sexual assault could be on a college campus. Every year, tens and thousands of parents send their children off to a university for the first time, often with smiles, the occasional tear, but overall happiness for their children to start the new chapters of their lives. According to RAIN, which is a leading researcher and statistic provider regarding sexual assault, 13% of all of these students will be sexually assaulted or be the victim of some kind of sexual misconduct throughout their time at college. Today, I would like to talk about the problem that is sexual assault and its root causes, Penn State's existing organizations and how they function, why a mandatory educational module will be beneficial for the university, and how and why the fines and punishments will be changed with the implementation of this module. I'd like to start by defining the problem. 1 in 5 women and 1 in 16 men are sexually assaulted while in college. 90% of these go unreported. Additionally, LGBTQ students, Black students, and students with living with disabilities all have higher risks of being sexually assaulted on campus. According to RAIN, 59% of all sexual assaults are committed by people that are known to the victim. 7% are strangers. With this, I'd like to implement another story. Around Halloween of last year, one of my really close friends went to a fraternity party at Penn State University Park, and while there, she got sexually assaulted. This was by one of the 59%. This was someone that was known to her, someone that she trusted, and due to this, I was able to see the causes that come with someone that has to deal with sexual assault. And these typically are various mental health issues, the biggest three being depression, flashbacks, and post-traumatic stress disorder. But that list is not limited to these three, and people can develop a variety of other mental health issues, such as substance abuse, dissociation, panic attacks, sleeping disorders, eating disorders, and in severe cases, pregnancy, self-harm, and suicidal tendencies. I also think it's important to address people's hesitance to report sexual assault, and I would like to focus especially on men here. Throughout the course of time, 30% of all sexual assault committed to men has been reported, while 70% has gone unreported, and that's millions of cases across tens of years. And I also think it's important to note that many of these victims, including my friend, have to deal with their own internal shame and possibility of not being believed in reporting. That adds even more to the stress levels that come with actually going through the reporting process. Currently, PSU has Title IX sexual assault services, and they also run a sexual assault service through the Interfraternity Council, or the IFC. Title IX is a federal law prohibiting sexual discrimination and sexual harassment on college campuses or in educational areas. And I would like to take a second to talk about what these organizations do. So when you report sexual assault to Title IX or to sexual assault services, you have the ability to go in and get a rape kit done, or you can get a non-evidence exam, which is more of an exam of the mental and physical state of the patient without actually having to go through the rape kit itself. The Interfraternity Council has a similar system set up, but it is inherently flawed, as you can see with my prior story. And in the case of my friend, when she reached out to the IFC and reported hers, they asked her if she screamed, and when she said no, they said that technically they couldn't do anything because she didn't fight back hard enough. So her sexual assault actually never got reported, and to this day, she still deals with the mental health issues that I touched upon briefly earlier. I also think it's important to note that there's a lack of education on the topic completely on Penn State's campus. Sexual assault is briefly mentioned at NSO and Accepted Students Day for us, but past that, it's not entirely touched upon at all. And punishments vary, but for me personally, most of the ones I've heard result in a suspension or a light fine. It's typically never expulsion or criminal charges. So that being said, I'm looking to implement an educational module that will be a required first-year course at PSU for all first-year students. Many of us thought that the first-year seminar, which was typically just a large lecture hall talking about career planning or how to adjust to college life, or maybe it was like a major focused one-credit course. But regardless, many of us thought that it was a waste of time and money. So the implementation of a much-needed course in an area that needs education would be a very big benefit in our curriculum. This course will focus on sexual assault and sexual harassment. So what that is, what it entails, how to recognize it. It will also talk about safety precautions to take when going out, when being in social settings where drugs and alcohol are present. It'll also expand upon the buddy system and blue lights that we have. Currently, they're not used as much as they should be, and in fact, the blue lights specifically are used as a joke. A lot of people will run by and press them thinking it's funny, when in reality they are made for sexual assault victims or people trying to get out of bad situations. I also think it's important to inform people on how to report and why reporting is necessary. I also think that with this, it would be beneficial to talk about how the reporting process works. So this will dive a little bit more into the evidence and non-evidence reports and what exactly someone will have to go through if they do report, and all of the support that they will have and the supportive organizations that they can attend at the conclusion of their case. And I also think an updated look at new fines and punishments would be extraordinarily beneficial. Like I said, typically it was a suspension or a light fine. These are criminal activities. They should be criminally charged, and expulsion should be mandatory. And as I stated earlier, this will be a required one-credit course at PSU. And I would like it to start the PSU level with just general academics and then slowly integrate into the IFC curriculum, solely because at Penn State alone, Greek life accounts for a large percentage of all sexual assaults and sexual misconduct. And I also think, again, that these people should be criminally charged. In conclusion, I talked about the problem that is sexual assault and its root causes. I talked about Penn State's existing organizations and their courses of action. I talked about why a mandatory educational module would be beneficial, and I talked about why and how the fines and punishments should change. When it comes to sexual assault, I think that sex in general and the principle of it, you're giving something very special to somebody else. It should be a beautiful thing, and I think this is one of the worst things that you can take away from somebody. And I truly believe that rolling with my policy and implementing it could be extremely beneficial for the university. Thank you so much.
Hi, Hi, my name is Vanessa McLaughlin, and it is my sincere pleasure to introduce to you Jasmine SIMPRI, a fourth-year biology major with a neuroscience option. Jasmine hails from Bushkill, PA in the Poconos and is studying to become a physician who works with underrepresented populations. Jasmine personally experienced bias and oppression by physicians and realized that many marginalized and minority patients experience this as well. In her speech, Jasmine proposes how to promote awareness and work towards eradicating this physician bias and oppression towards minority patients. Please welcome Jasmine SIMPRI.
Imagine you have a headache and it's so bad that it's a 10 out of 10 on the pain scale. So you go to your doctor, as you always do when you're not feeling so well. And your doctor says, can't be that bad, just a headache. But you know it's not just a headache, it was a 10 out of 10. So you demand to see a neurologist who tells you that it's worse than just a headache. Why did it take so long to figure this out? The healthcare system has been around for decades, and there has also been an increase in marginalized populations, including people of color, women, LGBTQ communities, and disabled communities. Yet, there has been little change within the healthcare system to reflect this population change within the United States. As a woman of color, I know that historically, women have been oppressed. People of color have been facing inequality for decades. And I have been able to experience this when I am a patient, and I will continue to experience it in my endeavors to become a physician. Although that everyone needs the healthcare system, there has been little change to reflect our changing demographic. This population is saturated by people with limited diversity experience. So Penn State needs to enact a policy that will require pre-med students to take diversity courses within their undergraduate so that they can have an increased communication and comprehension of diversity within the United States. I will explain why we need to focus on marginalized communities, how this policy will decrease discrimination in future physicians, and how Penn State can benefit now from this policy. To begin, numerous people are facing diversity every day. This includes 2022 census, which reported that 38.4% of the US population were minorities. So that's 4 out of every 10 people within the United States who are being discriminated against. And that does not include people in the LGBTQ community and people who are disabilities. So that means that's over half of the US population that are affected by this problem. Dr. Cameron, the professor of internal medicine at Northwestern, revealed how women are marginalized within the healthcare system when he reported that women have decreased hospital stays and patient visits even though they have the same demographic and the same health profile as their counterparts. Brian Smedley, the chief of psychology and founder of National Collaboration for Health Equity, revealed how minorities are marginalized within the healthcare system when he explained that minorities receive decreased quality care even though they have the same insurance, same income, age, and the same condition severity as their counterparts. Therefore, these populations have an increased chance of death from cancer, childbirth, health diseases, and diabetes. This is a significant problem. People are being ignored, people are avoiding health care, and they are eventually dying. This is an ongoing crisis for those who are losing their loved ones. And you, or someone you may know, have probably been impacted by this. Given this, there are various people who have the ability to enact change. This includes the Curriculum Committee, the University President, and the Elberly College of Science. All they need to do is create one meeting that can be created at any time for anyone's convenience in order to enact this policy. Furthermore, this policy, it impacts education. Medical school training is insufficient for the diversity and the change that we see in our population today. The Association of American Medical Colleges reported that only 40% of medical schools have diversity content within their curriculum. This policy will allow for early implementation of diversity content to try to make a difference within our diversity teachings. This also impacts the healthcare system. And insufficient healthcare leads to insufficient trust between the patient as well as the physician. In particular, this problem has been caused by the mechanics of the healthcare system. It was built for and only allowed originally for white males to practice. And even when females were finally allowed to practice within the healthcare system, there was little change within that system to account for these new women coming into this area. And even as change is attempted, discrimination is not purposeful. Physicians are not going out and considering diversity every day, and they receive little training to deal with this problem, but they are not purposefully discriminating. This policy will incorporate diversity into our future physicians' vocabulary. This mandate will require diversity courses such as SOC 211Z, Health and Equality. A policy that is enticing to pre-med students. It will look more favorable to med schools, as the U.S. News revealed in 2020 that med schools seek diversity, as this program, this policy, will produce students who are diversity advocates. This policy will require 2 diversity courses, each of 3 credits, and therefore will add 270 credit hours to the required 5,600 credit hours total needed for a pre-med graduate. In 2015, UCLA explained how they approved the requirement of diversity courses for their undergraduate. And in 2017, the University of North Carolina found that these diversity courses enhance respect and empathy, increasing community and conflict resolution skills for their students. Therefore, this policy is an easy way to make things work for diversity in the future and be able for Penn State to get ahead in their diversity efforts. Penn State can benefit now from this policy by having students that are more likely to get accepted into med schools because they'll look more highly upon from using the Penn State program and having a more well-rounded application from their diversity courses. It will elevate the Penn State brand as we will have a unique pre-med program and show Penn State's commitment to diversity. Lastly, we'll be able to attract more and better quality students to Penn State, as we are showing Penn State has a more prestigious pre-med program and is worth more. Some may say that the international cultures requirement does the same thing. However, as a disagreement, they do not require a studying of marginalized populations. 2020 Penn State News reported that CAS 466, the study of history of sports in modern world, satisfies this requirement. However, this would not satisfy the policy requirement for diversity courses. In short, there is a crack in the healthcare system. There has been little change to reflect the changing demographic of the United States. Penn State needs to adopt a policy that will require our pre-med students to take diversity courses, because attitudes take decades to change, but we can make an impact on our future physicians now, because we are Penn State.
Good evening. My name is Robin KRAMER, and it is my pleasure to introduce our next speaker of the evening, Jed Langille. Jed is a sophomore who comes from Westchester, New York, and he's a self-proclaimed car lover, dog lover, and most of all, he is a golf lover. He now currently is playing on the Penn State's men's golf team. Now, the topic Jed will be speaking about this evening is not something just widespread in our country or even our state here of Pennsylvania, but something that's hit close to home with his family. So without further ado, let's please welcome our next speaker for the evening, Jed Langille.
Picture yourself on a sunny spring-like afternoon in March. You meet up with your friend for some lunch, for some Greek cuisine. You sit down and order your favorite chicken kebabs with rice and vegetables when suddenly a gray SUV comes barreling towards you. Little did these two friends know that that would be the last seconds of their lives. This accident killed 73-year-old Therese Tafer and 76-year-old Jane Bloom, injuring 9 others in Chevy Chase just outside of our nation's capital. They lost their lives at the hands of an elderly man who lost control of his vehicle and crashed into the restaurant. Unfortunately, accidents like these happen too often from older drivers who should no longer have a license. It's particularly unfortunate when a lack of adequate legislation is what is contributing to accidents like these. Today, I will be outlining the need to change states' policies as it relates to senior driver's license by adopting Illinois' current policy. I will discuss the need for this policy change, the proposed new policy, as well as the advantages that having this policy will bring. There are many reasons why as people age, their functions for being a safe driver decrease. Older people can see a decrease in vision and hearing, decreased reaction time, and decreased cognitive ability for making split-second decisions while on the roads. They can also lose the ability to reason and remember from things like Alzheimer's and dementia, which can suddenly develop and go undiagnosed for a long time. Older people also have an increased use of prescription medication, which can significantly impair their driving. From an article from news.illinois.edu by Mark Rutter in 2005, drivers aged 75 and older have a 37% higher crash rate than younger drivers, and because senior drivers are more physically fragile, they are more likely to be injured in accidents and have the highest likelihood of death among any age group. Also, from Consumer Reports magazine in 2012, people aged 80 and older are involved in 5.5 times as many fatal crashes per miles driven as middle-aged drivers. And in recent years, there's been an uptick in older people on the roads, so it's more important than ever that this policy gets implemented. For example, 84% of Americans 65 and older held a license in 2021, compared to barely half of that in the 1970s. This comes from newsroom.aaa.com in an article written by Andrew Gross in May of 2021. People think that just because technology in cars has improved, that they're invincible behind the wheel. Meanwhile, they aren't. Also, this new policy will help families make tough decisions. My grandma, the woman on the right, came to the US at age 16 alone from England. And ever since then, she's been extremely independent. As she's gotten older, we recently told her that we didn't think she should be driving anymore and made her sell her car. She didn't take this news lightly. And while there are certain tips for handling conversations like these, like expressing your love and support or stressing the positive alternatives, none of these will be as efficient and effective as relying on the DMV to make those decisions for them. Now that I've discussed the need, I will next move into the plan that will help this issue nationwide. If we look at this map from Tao's Injury Lawyers from November of 2018, we see the US map categorized based on their state's current policies. The states in red have no special requirements for drivers of any age. The states in orange require in-person renewal. So for example, in Florida, if you're 79 and younger, you have to renew every 8 years. And once you turn 80, you have to renew every 6 years with a mandatory vision test. But then we move into yellow states that go a little further, and that's where Pennsylvania fits in. In Pennsylvania, all drivers must renew every 4 years, but if you're over 45, you can be chosen at random for a vision test, physical fitness test, written test, or you may be subject to a road test if those prior tests don't go as well. And then we move into Illinois, our only green state and our only state in the US that requires a road test when you renew your license. In Illinois, if you're 75 and older, you have to take a vision and road test when you renew. Between 75 and 80, you have to renew every 4 years, 81 to 86 every 2, and 87 and older every year. I believe that all states should implement Illinois' renewal policy. Vision and written tests just simply are not enough to determine whether or not somebody is safe to be on the roads. This policy can be done, as we have seen in Illinois. It would just be up to each state's legislatures to change their policies, and then up to each state's Department of Motor Vehicles to enforce these new rules. This policy is fair. If a driver belongs on the roads, they will retake the test, pass, and keep their license. It gives each driver the ability to showcase their functional skills to make sure that everyone is safe on the roads. And at the end of the day, having a license is a privilege and not a right. Licenses can be taken away for too many traffic violations, drunk driving convictions, so why can't it be taken away when somebody is no longer fit and able to be driving? And then we move into the advantages that having this policy will bring. If we look at this map from the National Highway Traffic Safety Administration in May of 2021, we can look at the older driver involvement rates per 100,000 licensed drivers in fatal crashes per state. The states in the red have a higher fatality rate than the state in the green, which is Illinois, which has the policy we're looking to implement. So as we can see, the red states on this map is the majority of the map. And out of the 16 states with the highest number of fatalities, 8 of them were red on the previous map and only require and have no special rules based on drivers of any age, and 6 of them only require in-person renewal. From the National Institute of Health, in an article by Brian Teft in 2014, mandatory in-person renewal was associated with a 31% reduction in fatal crashes involving drivers 85 and older. If we adopt even stricter policy, these numbers will only improve more. Since older people suffer more serious injury and death, saving just one life would make this policy a success and preventing a family from going through that grief. And lastly, less family strife. While this can't be quantitatively measured, there is no price tag that you can put on family harmony. With my grandma, we did it because we love her and we would never want to lose her. This policy would make these situations go so much smoother because it takes the blame off of the family and puts it onto the DMV, making them look like the bad guys. It baffles me that you can take a road test at age 16 and potentially go unchecked for the rest of your life. Many lives would be saved if each state followed suit with Illinois' policy. This policy weeds out unsafe drivers and keeps them off the roads before accidents happen. Think about your own grandparents and loved ones that this policy would be serving to protect. This policy isn't meant to target older people and strip them of the opportunity to drive, but rather protect them and keep them from operating such a powerful and dangerous vehicle that can be used as a weapon when operated in the wrong hands. Thank you.
Hi, my name is Vanessa McLaughlin, and it is my sincere pleasure to introduce to you KAITLYN MARWAH, a sophomore student studying supply chain and information systems. KAITLYN is from Phoenixville, PA, just outside of Philly. As part of the Greek community, KAITLYN noticed the need for additional personal safety measures for students. Here is KAITLYN's proposal to improve students' personal safety, specifically off campus. Please welcome KAITLYN MARWAH.
Through September of last semester in fall 2021, there were 44 reported rapes and sexual assaults at University Park, some of which were reported in the only 13 timely warnings that were issued in the first 6 weeks of the semester. As a Penn State student and a member of fraternity and sorority life, I understand the concern for safety, and it is up to the Greek community along with our school to ensure we all feel a sense of security. Although Penn State has implemented an emergency blue light system across campus, the advancements of our campus population and nightlife require a greater safety net. Therefore, I propose that Penn State installs more emergency lights across campus as well as downtown along Fraternity Row in partnership with the State College Police Department. I'm going to identify and define this problem to you, how it harms students, and why the policy in place needs to be improved by expanding, which will increase student safety, mental health, and overall make Penn State a more appealing campus to prospective students and their families. To To put this into perspective, Penn State has 40,000 students, and approximately 20% of those are involved in Greek life. This means keeping the student body safe is a massive undertaking. The issue of the surge in sexual assaults and misconduct impacts the students' safety, mental health, and overall comfortability at Penn State. Detective Craig Ripka of the State College Police Department reports that from the moment students return to campus, which is in about mid-August, to about the second or third week of October, is when the majority of sexual assaults occur, and this is commonly referred to as the red zone. The red zone is the combination of students returning to campus, freshmen getting their first college experience, and outsiders coming into State College for football season. All these factors can lead to over-trusting, just getting your bearings, and can lead to some pretty dangerous situations. This problem falls under issues revolving the safety of our students, mental health of our students, and Penn State's reputation. If Penn State becomes known as an unsafe campus, that will turn away students, their families, and will result in lost tuition. This issue can be solved through collaboration of President Eric Barron, Penn State's administration, and the State College Police Department. The cause of this problem is Penn State's lack of safety protocols. Penn State only has about 90 emergency blue lights across campus. These emergency blue lights are a direct communication line to the university police. They often have 24/7 surveillance inside them, and they are a source of light during the nighttime. In order to be considered a blue light safe campus, you must be able to see the next blue light from standing at one, which is certainly not the case here on campus. In order for this to be true, Penn State would require 1,000 emergency phones to be sufficiently covered. Not only are students not being protected on campus, but assaults commonly take place off campus in and around fraternity houses, which are reported to the police. This can deter students from coming forward and filing reports because it's more daunting to go to the police than it is to go to your school. According to the 2020 Department of Justice statistics, more than 2 out of 3 assaults do not get reported. So every time a student receives a timely warning, think about multiplying that by 3. In the past, Penn State has implemented the 90 public emergency phone towers, some of which are positioned inside buildings and some outside. Some buildings on campus also have 24/7 employees inside. As pictured in the map created by Penn State University's safety page, you can see where each of the blue light emergency phones are located. This has not worked in the past because there's not enough to cover campus or downtown near the fraternities where many students are often during the weekends and late at night. Now, I propose a policy which contains both a system change and a mandate. First of all, there needs to be more blue lights installed on campus, as many as the budget will allow for. I'm also proposing that lights be installed on each block covering Fraternity Row in downtown State College. In order for this to work, the school would have to initiate a partnership with the State College Borough Police. They would be the ones answering the calls and managing the lights off campus. In addition to this partnership, I'm also suggesting a tip line be created that directly feeds to the police from the university. As Maddie Eichen writes, Ohio State has 210 blue lights. The lights are not confined to only the university's campus. They're present in the surrounding neighborhoods of Columbus. Despite these benefits, some may argue that the benefit from these additional blue lights may not outweigh the cost. The emergency phone sector of Penn State University Park website states that the cost is about $15,000 to $20,000 for installation per blue light, and from there it's a $25 operational monthly cost. I challenge you to think about every school, home, business, any building really, and how each of them has a fire alarm system or some sort of precautionary fire system. Although it is only used in the case of emergency, it is necessary, and it's the same case for these emergency blue light phones. These emergency light phones provide a safety blanket and sense of comfortability for our students. According to Rebecca Wood of the Daily Illini, the University of Illinois has 675 emergency phones on campus. She also shares that the University of Illinois' emergency phones have not only been commonly used for reports surrounding assault, but for students who are experiencing a mental health crisis, such as students contemplating suicide or hurting themselves. This is why these lights are so important to have. Moving on to the feasibility of this policy, which is easy, as one light is equal to the tuition of one student. And shouldn't we be looking out for each and every one of our students? This policy would be extremely effective, as it would make students feel safer, and because of this, attract more and please prospective students and their parents. Furthermore, the end goal of these lights is to deter and lower crime in the Penn State College area. All in all, Penn State cannot call itself a blue light school with its minimal amount of emergency blue lights across its vast and expansive campus, and therefore must increase its amount both on and off. 90 emergency blue lights are not enough because students will not take time to memorize their location. They need to be readily available and seen from any point. It is also imperative that they are made an option off campus for the 20% or more of the student body who spend time on fraternity row, where many sexual assaults take place. Let's counteract what has become commonly referred to as the red zone with blue. Thank you.
Hello again, and thank you for staying with us through the duration of the contest and giving these students the recognition they deserve for the excellent speeches that they've prepared. I would now like to announce the results of this contest. So I will begin by naming our honorable mentions. Based on the cumulative score of the 3 judges, these are the 3 competitors that fell in the bottom 3 ranks. However, they are announced in no particular order. The first person that deserves an honorable mention is KAITLYN MARWAH, for the speech on the topic of installing blue lights at Penn State University. The second honorable mention is Zachary Stanton, for a speech on the topic of sexual assault on Penn State's campus. And then finally, a third honorable mention is Emily Bromirski, for a speech on the topic of mental health resources here at Penn State. And so again, congratulate all 3 of them on the excellent work they did. Simply being in this final round was a huge accomplishment. And now I will announce the top 3 results. Our third place speaker was Justin Langille for a speech on the topic of senior driver's licenses. This student was instructed by Robin KRAMER. Our second place in the final round was Jasmine SIMPRI for a speech on the topic of mitigating healthcare bias. This student was instructed by Vanessa McLaughlin. And then finally, our first place speaker in the final round was Frederick Miller for a speech on the topic of conversion therapy. And this student was instructed by Mark KOHLER. And so, thank you again for staying with us, for taking a moment to observe the results of this final round, and for generally taking the time to support this group of students for all of the excellent work that they've done. And so, I hope you have a wonderful evening, and yeah, thanks again. Smash that like button.